Hey, what's up, athletes? Today what we're going to talk about is an interaction between the glutes and the adductors and how that can be affected by hip mobility. I'm going to show you how to set up the resistance band to maybe practice the hip mobility, and then also we're going to talk about big diaphragmatic breathing. It really comes down to simplifying the day-to-day things that we need to bring awareness to in order to get through big blocks of training. If you were to wake up and you feel super sore, you feel a niggle or a twinge in the hip, knee, ankle, wherever, you don't want to make it worse by continually training on it. But what we can do is spend about 15 minutes doing some controlled movement on it, and then eventually it might just go away. And most of the time it does. It's amazing how an athlete, once they start manipulating their body either with foam rolling or hip mobility, something that feels like an injury could be instantaneously gone, just like that, just by practicing a few different movements and experimenting. One of the first ways that we're able to get through big blocks of training is to make sure that our glutes are staying active. About running especially, is it deteriorates our glutes. I take off my shoes and I can show you the movement. My adductor, my inner leg muscle, communicates with its reciprocal muscle in this instance, and for this movement it's going to be the glute med. I want you to try, and if you suck at the movement, you know we're going to need to do some hip mobility, strengthen the glutes, do a little bit of both. So I'm going to balance on my left foot. I'm keeping the hips square. So this is open, this is closed. Just square to the ground is fine. I want you to hip hinge forward, knee is soft, that back toe is pointed in dorsiflexion, hand goes on the hips. I open up just like this. Notice how my glute med contracted and my adductor lengthened, that inner leg muscle, and then I close. I want to keep pressure on the big toe and on the heel. Equal pressure all the way through the bottom of the foot. Open. If you're a little squirrely, that's okay. Just nice and slow and controlled movement. And time. If the adductor feels really tight or the glute doesn't seem like it has a lot of strength, there's a couple things that we can do in order to try to fix this issue. By doing some glute bridges, getting a resistance band, opening up, doing some lateral steps, doing some transverse steps, doing some single leg deadlifts with good posture. That's the strengthening part. But also we need to work on a little bit of hip mobility. Remember, our femur that goes into our pelvis is a ball and socket joint. Put pressure on every which way in the hip to really try to work out the length of those muscles and create a little bit of space. Thread it through the bottom this way. And then we're opening up the other end and threading the resistance band through, just like you see here. I'm gonna put my right leg through. I'm gonna bring the resistance band up, I say just as high as like a bikini, not like a thong. And the leg that's in there, I'm gonna step back and I'm gonna set that ankle down. Imagine a little bit more posterior pelvic tilt. I'm going to gently squeeze my right glute. I'm going to keep the hips square and I'm going to shift forward, trying to eliminate the lower back arching very much. I'm going to lift up the hand and go to the opposite side. Just play around with it. It's a ball and socket. So you just want to create space, open up space. After multiple days running, this feels really good and intense at the same time. So to stretch the adductor, remember, put it halfway down the thigh. That back lower leg stays parallel with the resistance band, and I'm going to allow the resistance band to pull my leg backwards. I'm going to shift my hip forward, and I feel a deep groin stretch. So for a lot of endurance athletes, it's those inner leg muscles that can manifest itself in lower back pain or just hip pain in general. When you go to a massage therapist, they're not going to be massaging your groin muscles or your inner thigh muscles. It's just too invasive. Even your glutes, but that doesn't mean it's not just as important as your back or your calves or your quads. Let's visualize the glutes as something electrical. just increasing the electricity to the muscle is going to make it strong. Before we try to increase the amount of fibers in a muscle, like if we need to get bigger glutes or stronger glutes, we need to increase the amount of electricity to the muscles by doing isolation. Isolations are very simple. You can start out by doing this with 2 feet, but if that becomes too easy, you can do it with 1 foot. Make sure that our ankles are hip distance apart, toes are straight, hands can be on the ground. We can increase difficulty level a little bit by crossing over. I'm going to keep it here. I feel like I'm able to access my glute a little bit more. I'm just going to do some double leg glute bridges, making sure that I really squeeze my glutes, but I don't come up too high because that's going to cause my lower back to arch. I'm definitely going to feel some pressure here on the upper part of the quads. It almost feels like it's a strengthening exercise for the quads, but it's really the glutes trying to expand the hips and open those up and put the leg into extension in the hip capsule. So it may feel like the hips are shorting out a little bit, but that's normal. You just need to stretch the quads a little bit more, or it means that you're just training really hard, which is okay too. After each set, focus on big diaphragmatic breathing. If we wanted to place our hands, one at the top of the iliac crest, the other at the bottom of the rib cage, we're going to try to relax the belly. In our society, we don't want to relax the belly because it makes us feel big. We need to let go of that unconscious anxiety. Really take a deep breath in through the nose, out through the mouth, in through the nose, out through the mouth, like you're trying to blow out a whole bunch of birthday candles. We call this birthday cake breathing. Increase recovery even by 3, 4, 5% over a certain amount of time, which could equate to 3% more results when it comes to race day. Do 5 breaths. I'm gonna try to keep my belly expanded for the last one. We're able to take really deep diaphragmatic breaths and let go of the feeling that we're feeling big, then that's gonna go a huge way into increasing our performance. Okay, so we broke down a basic movement to see if our glutes and adductors are communicating. Then we stretched the hips, opened up a little bit of space in the ball and socket joint. Then we stretched our inner leg muscles, our adductors. And then we strengthened the glutes a little bit, and then we took some deep breaths. So now we're at baseline, we're relaxed. We're gonna try that movement we did at the beginning again and see if I'm any better. Hip hinge forward, knee soft, hips square. I open up. Wow, it feels much easier. I didn't feel as much tension when my hips were open, and it just feels like I'm gliding more on my hip. I felt my glute fire a little bit better. It felt a lot stronger, and after stretching my adductor, it felt like when I was opening, I didn't have to fight against my inner leg muscle, which is my adductor, because we lengthened it. So there you have it, a simple movement that takes the glute and makes it talk to the adductor, gives us a little bit more control with our hips. If we try that movement and we're not so good, do the hip mobility and see what happens. Remember, we stretched the hip capsule, the adductor, strengthened the glutes, did some deep breathing, and then we went back to the movement to see how we did. Hopefully that makes sense. And if you want to see other videos like this, you can see right here or right here. Please like and subscribe. If you have any comments, comment below. Till next time, later.